Hi, my name is Jack, and I'd like to talk to you guys today about discrimination within the queer community. But before I start, I'd like to go with a little story about how a couple years ago, I was visiting Halifax, Nova Scotia, walking downtown, and I happened upon this bookstore called Venus Envy that looked rather gay from the outside, so I knew I had to go in and check it out, see what it was about. And when I did, I stumbled upon this book that caught me very off guard because it was called Why Are Faggots So Afraid of Faggots? Flaming Challenges to Masculinity, Objectification, and the Desire to Conform. So it's a little bit of a shocking title, but what was, I guess, kind of funny and weird at the time was I really felt like I needed to know what was in this book. Because as much as I was caught off guard, I couldn't help but admit to myself that I was a faggot terrified of other faggots. So if this book had secrets, I needed to know more about it. And what I learned was it was actually a collection of essays written by gay people, self-identified as faggots, who are reclaiming the term, and talking about the ways that they had encountered discrimination within the community, but really coming from a place of empowerment and fighting back against that discrimination in order to make the community stronger. What was neat was I realized at that time that a lot of the stories and research that I had encountered about gay men in the past were told from the outside looking in by straight people discussing gay people. And this was the first time that I had really seen such a clear example of gay people discussing the problems that they face. And I was fascinated by it. And ever since then, I was interested in being part of that work, which brings us a little bit closer today. So I'm gay and I identify as queer, and I use he and him pronouns. And I've become very interested in clinical psychology, specifically from a queer lens, as well as social determinants of health, which is how parts of your social identity, whether it's your sexuality or how much money you make or your gender, affect your health. Because it's a little bit more complicated than just what's happening in your physiological systems. So that's part of why I joined the Investigators 2019-2020 cohort, just so I could learn more from experts as well as my peers about how a queer identity, and especially gay men's identity, affect their health. What I didn't realize at the time that I discovered and was becoming excited about that book and this idea of gay men studying gay men was I was actually discovering something called community-based research, which is where a community is involved at all levels of the research being done on that community. It's great for a lot of reasons. Part of it is because it's helpful for achieving social justice. So if the community is involved in the research being done on itself, it's more likely that that research will produce outcomes or knowledge that can be then turned back to use and help that community. And also it produces better research. Something that I found fascinating about that book was it didn't seem like straight people would have been capable of asking and answering the questions that the gay people, the self-identified faggots, were able to approach and answer through those essays. And so when a community is involved in the research, you're able to get a closer look at what's going on. Now, for the community-based research that I wanted to do today and talk to you about, we took from the survey called Sex Now that was collected in 2018. It's the largest and longest running Canadian survey of queer men's health, and it's collected primarily through pride parades and online. Now, that's an important point because it's easy to get, I guess, lost or misled with survey research because all of your findings are really only about the sample that you collected data from. And if we're mostly collecting our data through pride parades, that means that our respondents are probably disproportionately white, disproportionately cisgendered. They're more comfortable being out and expressing their identities, on the streets of pride parades. So it's important to interpret our data through that lens and that's who we're studying and that's who we're talking about. But still, being the largest and longest running Canadian survey of queer men's mental health and health in general, it's a very valuable tool. So the two questions I was interested in from the survey were whether or not that the gay men answering the survey had experienced discrimination from gay, bi, or queer men in the past year, as well as whether or not they were satisfied with their connections to the LGBTQ2S+ communities. So, first and foremost, just looking at that discrimination question, we can see that this is what our sample responded. And the most common types of discrimination experienced by our sample were discrimination against themselves for their body, discrimination against them for their age, and discrimination against themselves for their race. Interesting. Okay. So it's evident that definitely our sample is experiencing discrimination from other gay men, and this is also just discrimination within the past year. So that's something to look at. What I was interested in was taking it a step further and seeing whether or not that discrimination affected their sense of satisfaction with the community. And it seems that it might. So on the x-axis, we have discrimination. And if on the left, we have, yes, they had experienced discrimination in the last year from gay men. And on the right, we have, no, they have not experienced discrimination. And then in the legend, the darker gray is them responding, yes, I feel satisfied with my connection to the LGBT community. And the lighter gray is, no, I do not feel satisfied. With on the y-axis, we have frequency. So just the number of respondents that fit that criteria. And what we see is that if the respondents reported feeling no discrimination in the past year, they were far more likely to experience a higher connection and satisfaction to the community. And as I alluded to at the beginning of this presentation, there's a lot that comes with a positive sense of connection to the community, a lot that positively affects your health. Because if you're connected to the community, you might be more likely to know helpful public health knowledge. You might be more likely to access protection from outside negative forces. There's a lot that comes in terms of benefiting to you that if you don't have that access to the community, you're more vulnerable and more likely to get hurt. Cool. So I'd like to end by saying that there still is a long way to go for our community. And specifically, there are some groups within our community that are more vulnerable and face a much higher risk than others, including and especially Black queer people and Black trans people. There's been a lot of conversation lately about how forces like police brutality or COVID-19, or even honestly just our silence, is endangering these people. So I'd just like to end by saying that Black queer lives matter, Black trans lives matter. I love our community, and I'm looking forward for us to have brighter tomorrows.